In line with each other. Take a deep breath in and fall. And there we go. Big squeeze and push. And that was a much bigger one, I think he'll tell you. Nice and loose. Nice and loose. Good. Cross the arms. Hey everybody, Dr. Bain here. Have a really cool case today. I got one of my patients here, Dan. We're going to show you, just like we normally do, our regular chiropractic visit with ABC, the unique treatment we do, but we also have a really cool thing we're going to do at the end where we're actually going to do a facial bone treatment on Dan. So I'm really excited to show you that. So Dan, I'm going to have you right there for me. Let's just get a picture of your posture. Oh, there. Perfect. And Dan's been already seeing me for about 3-ish months, so his posture's already pretty darn good. Oh, thanks. Go past this here. Look down for him. Back to normal. So I'm just checking his scar tissue here. And one more time. Back to normal. And look up. Back to normal. So now I'm checking the posterior meninges of his spinal cord. Look to your right. Normal. And left, back to normal. Perfect. And one more time, down, back to normal. And he happens to have one piece of scar tissue to do, so we're gonna do that now. So actually first, let me feel, so I'm gonna tuck your chin, and then when I tuck your chin, I want you to curl your body forward like that. Perfect. So what I'm doing right now is I'm feeling which bones are not separating on his back to figure out where this glue is. See, and it's right about, it's a little bit lower, somewhere right here. Yeah. So what I'm feeling for is I'm feeling for these bones to separate properly. It's also got a little one. So he's got one right here and he's got one down here. My guess is this is probably the one that we need to get rid of. So that's what we're going to do first. So I'm going to have your head there, feet there for me. So a lot of people always ask me about these because they look pretty crazy. Oh, and Dan, I'm actually going to switch this way. This is the curl up one. So a lot of people ask me about these a lot of times because they think they look pretty crazy, and they are. But what we're doing is this has nothing to do with bones. Absolutely nothing to do with bones. This has everything to do with an internal scar tissue that builds on the inside of your spine. What we call meningeal scar tissue or meningeal adhesions. There we go. Bend the knees for me. So what I'm doing is this scar tissue is at the front of his spinal cord. So I'm putting his body in a position that's going to make that scar tissue tighter so that I can release it out of there. So by curling him up like this, that's getting that scar tissue tighter, and it's going to allow me to get rid of it. Nice and snug. And I'm just going to get the dots here. So I also put dots on people. What the dots do is they help me get my angle better. There's one. And here's, oh, hold on. I just realized something. Give me a sec. Okay. Had to pull up your file. I already remembered that Dan was a left, so I already started going. I forgot to pull up your file. Okay, so got my dots down nice and snug. He's in the right position. Let your arms relax. So now what I'm going to do is I'm going to curl him up. Nice and loose. Let your head fall in my hands. And I'm waiting until I feel that scar tissue piece. He's already starting to feel it. Waiting for that scar tissue piece to get tight. Relax your body. And there it is. So now you can see his body starts to get really stiff. I'm going to bring him over, keep that tension. There it is. I'm going to turn his head so these dots are in line with each other. Take a deep breath in and fall. And there we go. And there we go. And there we go. So pretty easy. You guys can hear a couple cracks there, but that's not the goal of this. The goal was we have to get rid of that scar tissue piece in the middle of his upper back. Perfect. Okay, come on over here. Awesome. Take a deep breath. And you can already see his posture is a lot further back already. Look down. and back to normal. Good, and now it's gone. So now I can move on to bones now that he's clear of scar tissue. Okay, so I'm checking C7. So he has just a little bit of a C7 forward, so back right here for me. Cross your arms, little step back. So C7's all the way up at the top here, and this is the biggest reason why people have really slouched forward heads. So you have to get this one done properly. Drop the shoulders down for me, and just look straight ahead the whole time. So I'm going to do a couple little pushes here just to make sure I'm on the right spot. Shoulders dropped. Good. There it is. Perfect. And elbows a little closer. One more. Drop your shoulders down. And it doesn't take much, you just got to have the right angle. Perfect. Right to face now. And now I'm going to recheck. So I'm going way up to the top here. Still got a little bit more. There's no point in moving on to the next one until you get C7 because that's probably the most important bone in the body. Chin neutral right there. Shoulders crossed a little more. Little step back. Drop the shoulders down to the floor. There we go. We'll keep those shoulders loose. Perfect. Yes. And now we check again. Good. Okay. Now we're on a T2. Cross the arms. Shoulders dropped in legs. Oh, hold on. There. Now, okay. Couple little pushes just to feel it come on the spot. Relax your shoulders all the way. Good. All the way down, just drop them. More. Loose. Loose. Don't let your head fall to me. Perfect. And relax. Better. Good. So I'm just going one by one. And the biggest thing that I'm doing here is instead of moving bones more forward, I'm moving them backwards. Okay, so he also needs a first rib, that's why his shoulders are slouching. So tender check. Any tenderness? Okay. So do two big chops here. Nice and loose. Nice and loose. Good. Cross the arms. He also has T4. Shoulders relaxed. It's all about subtlety. Shoulders loose. And let your head fall to the floor all the way. And see, you didn't hear a big crack, but I felt a little shift right here. And what you'll see now, take a deep breath. You see now no longer are his scapula winging. You see when T4 is forward, the scapula will wing out like this. That's one of the reasons people can't have good posture. And once again, unfortunately doing this the old way, they're pushing the bones more forward. So you can't fix forward posture by pushing bones even more forward than they already are. So this is why they don't really get posture changes with their patients, unfortunately. Okay, so he's also got one way down here, about T8. And once again, it's all about subtlety. Shoulders loose. It's more about the angle, not about pressure and fast. Shoulders drop more. Let your head fall along with your shoulders and now fall forward underneath. And that was it. There was a microscopic little shift. Shoulders relaxed, and that's all it takes. Because you can see as we continue to work on him, his posture is getting better and better. There we go. Good. Okay, now we're getting into his lumbar. He's got one way down here about L1, T12 L1. You can even get those all the way on the wall too. There we go. Shoulders relaxed. There we go. Stomach relaxed. Shoulders. Let your chin tuck to the floor. Let your body slouch. See? And that was it. Right away. The second he relaxed, But the arms relaxed. It easily moves. And that was a mistake that I was making for a long time, where I was pushing too hard. And I found out if you push too hard, you actually shift just as many bones forward as you do bring some backwards. So subtlety is really the key here. He's also got L5. Okay, so sit right there. Feet right in front of you. Cross the arms. So L5 is forward, so I'm going to block at L4. Tuck your chin down to the floor. Let your stomach relax. And let your body go. Now that one did crack a lot. That's just because it was really forward. But it didn't take much effort. Right there. And you can really see how that stood him up a ton. Check your sacrum here. So now I'm checking his sacrum. Both sides. I like to take my time. It's better to do it right the first time. In fact, right here, you may have a sacral problem here going on. And he does. So I'm going to grab this guy. I'm just going to push forward that right side of his sacrum. That's all it takes. Just a little push. Check the base of the sacrum. Make sure it's not dropped down. And I'm going to check right back up to that C7 again. Make sure we didn't pull that forward. Okay, C7. So when you do lumbar, unfortunately one of the things that happens is you pull forward that C7, but you have to have fixed that first in order for the lumbar to move easy, so you kind of have to just come back and redo it again to fix it again. Shoulders crossed, feet back a little more. And elbows a little tighter for me. Now you can let them relax. Perfect. So a couple little pushes here just to feel it. Now, keep your shoulders looser. Looser. Let me move them all the way up. Good. Look straight ahead. Chin up a little more. Right there. Now drop your shoulders more. Perfect little click. And what you're going to see now, if you look from the side here, take a deep breath. What you're going to notice from beginning to end here is how much his head has started to come back. When C7 is forward, the head directly translates like this. So when you bring C7 back, it immediately will suck back like that. Okay, so take a deep breath. I'm just going to look at his posture again just to see if I'm missing any spinal bones. Okay, so I am right here. So once again, you can see his scaps have winged out again, so we have to do T4 again. And cross the shoulders relax. Oh, that's perfect. Let the head relax all the way down. And that one you did here, little click. But watch this now. Look at this. Deep breath. And you see now about another half of his slouch is gone. And to fix the rest of his slouch, I'm just going to do a couple of gentle rib lifts. Relax your body. And these are subtle. You just stand straight up. There you go. All it takes. Arms up high. And relax. So I'm just gently lifting his ribs, arms up really high, yep, and relax. And this is enough to get rid of very small, and you heard that one, small forward bones. Take a deep breath. Perfect posture. He's not swaying back and forth. His head is in line with his shoulders, which is in line with his hips and knees and feet. Last thing, I told you guys I want to show you a really cool thing. So the bones of the face can actually get compressed in, okay? Maybe you got punched in the face, you fell, a softball hit you. So these things can get compressed in, and that actually creates spinal cord tension, a lot of symptoms for people. Headaches, migraines, dizziness, sinus issues. So we're going to check those now and see if he has any. So I'm going right on his facial bone here. I'm going to a very particular point, and I'm just going to press it. I'm going to see what happens. Seeing right off the bat, he has a facial bone out on the left side of his face, so we're going to do that now. So I'm going to have you head here, feet there for me, Dan, face up. So we got a pretty interesting kit here. And then Teresa, I'm going to have you pretty much straight down over here so you can see everything. So we got a lot of tools here. So what we're going to do, and Dan, I'm going to get a little bit of KY here, so that's just so the balloon can feed in a little easier. So what we're going to be doing is we're going to be feeding the balloon into Dan's face there through his nose, We're gonna get it into the specific area that we need to. And then after that, we're gonna blow up that balloon really quick to fix this side of his face here. So first I'm gonna get a little KY on there. And that's gonna feel really weird there, Dan, so just relax as best you can, breathe through the mouth. It's gonna feel really funky, okay? So now I'm gonna get my balloon here, make sure I've got it nice and tight. I'm gonna get my toothpick and I'm gonna get a little bit of this KY on there. So it's gonna feel really strange, okay, Dan? So you're just gonna stay really relaxed. It's gonna go really deep, more than you think it can go. Good. And we're just gonna start feeding this into your nose. There you go. There, now we're starting to make some progress. So we're just starting to gently feed this into his face. So we're almost there. It's gonna go a little deeper, Dan. And we're about to hit that barrier. And there it is. Now we make sure that the toothpick is facing the correct direction, meaning I'm in the right concha, which I am, so I'm gonna pull that out. Now the only thing that's gonna stay in there is the balloon. I got this nice and tight, so Dan, what I'm gonna do is I'm gonna clog your nose like this, really tight on both sides. I'm gonna blow the balloon up. You're gonna feel a crack in your face. I'll pull it out and then you can blow your nose, okay?
Okay.
So you guys are gonna wanna watch this. Here we go. And there it was. Perfect. Let me get you some, where's the Kleenex? Let me get him some Kleenex. Okay, so I'm gonna get you some Kleenex, Dan. Here you go. So now we just did one part of his facial bones. Here's another one for you. Not too bad? You took it pretty good. So now though, that's only one. There's 5 others I have to check. So I'm gonna have you stand up here for me. Okay. So take a deep breath. And now you can even see how his posture got better. How's the breathing? You hear that? A lot better, yeah? Mm-hmm. So you can see the breathing got a lot better. You see, the thing is, when you have facial bones out of place, that completely affects the nasal passages, so you can't breathe as well. So now I'm gonna make sure I got that out of there. Yeah, and that's way gone, not even close. So now we're gonna move on to the second one here, second facial bone to check. I'm just gonna make sure I'm right. And the thing is, these are very small areas that you have to hit perfectly to get the right, accurate picture. It's right there. So this is the second concha that I need to check. That one's fine. So now I gotta check the third one. Third one's fine. So now we're gonna check the right side of his head. The same 3 spots. So that's the thing is, when you get the right spots done, some other ones that were positive before will clear out. Okay, so Dan potentially has one more here, and actually in the same concha on the opposite side, same facial bone. Yeah, very slight, but it's there. Now he's had a history of a lot of traumas to his face, so this makes a lot of sense for him. So yeah, he has the same one, but on the other side. So same thing we just did. So we did the exact same thing, but now we're going to be on his right nostril in the same area of the facial bone. So a little bit of KY here on this side. Perfect. Doesn't take much. Okay. Okay, so same exact process, but now in his opposite concha here. So I'm going to get this KY pretty entangled in there. And here we go. We're going to start feeding it straight into his nose. This side's actually easier. It's not as collapsed as the other side. See? And then we check the toothpick. It's in the right spot. Pull it out. Same exact thing. So relax your face there, Dan. Big squeeze and push. And that was a much bigger one, I think he'll tell you. And that was a much bigger one, I think he'll tell you. That one cracked a bunch. So a couple of little pieces here for you. Blow your nose there.
Felt that in my ear on the other side.
So a lot of people, here's the thing, a lot of people say that they have clogged ears. They get these clogged ears or they get these clogged nasal passages, chronic sinusitis, and they can't explain it. Well, imagine this, right? If your facial bones are out, right, compressed in, well, what happens? That's an injury, right? Take a deep breath. Look at his breathing in his chest. You see, even though we're doing nothing here, by doing the facial bones, his chest is expanding better. Okay, but a lot of people get chronic sinusitis. Well, imagine this. If you have an injury to your face, what happens chronically? You get inflammation. So what is sinusitis? It's sinus inflammation. So this is one of the reasons structurally why you can get sinus problems but not have an infection, which is why your antibiotics aren't doing anything for your sinus problem, because it's a structural problem. It's not a chemical problem. So now I'm checking his second facial bone here. That one's fine. And now his third facial bone area. And that's fine. So now Dan is completely corrected from top to bottom, facial bones and structurally with his spine. And I'm also going to post on there pre-post pictures of his face, because you're actually going to see how his face evens out a ton and how a lot of his facial correction and the distortions that are in his face from those traumas are going to have reduced. Thank you guys so much. It was nice seeing you.